Hi everyone, thank you so much for being here with me today. My name is Farah Azlin and I am one of the clinical psychologists here in Naluri. Today, I will be sharing with you on the topic of taking care of our mental health post-COVID-19 recovery. To get started, I will be sharing with you some of the agendas that we are going to be discussing together. So firstly, we are going to understand first how does the outbreak of this pandemic has been impacting our well-being and has caused a rising issues in regards to our mental health. Secondly, we are going to dig deeper into understanding what does someone who actually has been impacted by the virus post-recovery. So we are going to understand a bit more on how is their mental well-being doing. And of course, we are going to learn some techniques on how to manage these mental health concerns. And last but not least, I'm sure some of you may know someone, or perhaps you yourself are someone who has recovered from the pandemic. So we are going to learn together how we can support someone who are actually at the phase of recovering from the virus. There are actually multiple studies that show how the pandemic has been impacting our mental health and also our emotional well-being. So what I am sharing with you here is just some of the symptoms that has been found by studies, and actually there are a lot of ongoing studies to understand a bit more on how does our mental health exactly being impacted by this virus. So as you can see, there are two aspects that we can look at when we're talking about mental health issues. Firstly, in how the pandemic itself has been impacting our mental health. So I have listed down here some symptoms that one or any of us may be experiencing. It could be something like anxiety. We have this fear and worry. What if I get this virus? What if I'm going to impact my family members? And also there's a lot of fear and uncertainties on our job, perceived fear that we may not be recovering from all of this pandemic. So these are some of the things that does happen to any of us when it comes to this virus. Secondly, we look into the aspect on how does the lockdown and also this restriction movement has been impacting us. So you can see social isolation is actually a big thing that has been happening amongst all of us. From that as well, we do notice that people started to feel burnout. There's lack of boundaries in regards to life and also work. So these are some of the issues that we do notice happening within the community when it comes to the impact of COVID-19 pandemic on our well-being. So just now I was sharing with you on the general impact or some of the general mental health issues that anyone can go through due to the pandemic. But now let's go deeper into understanding those who are actually infected by the virus and is going through the process of post-COVID-19 recovery. So what exactly are some of the mental health issues? So there are three main aspects that we are going to discuss and uncover together today. First is in regards to the physical symptoms. Secondly, emotional symptoms. And last but not least is the thoughts process or their cognition. Before I share further on the different symptoms based on these three aspects, I would like to give you a bit of a disclaimer here that there are still ongoing research that is trying to uncover and investigate further on the impact of this virus on our well-being. But then, of course, there's still some symptoms that we can look out for, either for ourselves, for anyone that we know who are actually going through the phase of post-recovery. So in terms of physical symptoms, based on the reports that shown by CDC, what they have reported is that the symptoms, the physical symptoms, it may still last for a few months, even after we have recovered from COVID-19. So some of the symptoms as listed here, one of it is actually poor sleep cycle or insomnia. And you can also notice some of the symptoms listed here. It's quite similar to the symptoms when we are actually being affected by the COVID-19. You can experience symptoms like difficulty in breathing, maybe we experience tiredness or fatigue, heart palpitation. And another thing to note as well, these symptoms may also be part of the physical sensation that happen when we are feeling anxious. So these are actually normal symptoms that one may experience as according to the report by CDC. So I'm going to share with you some of the techniques that we can incorporate in our life as part of the process of recovery from COVID-19. I understand the physical symptoms may be uncomfortable for you. Hence, it is why it's very important for us to identify the symptoms and work on it based on some of the techniques that I'm going to share here. First and foremost is to actually practice good sleep hygiene. So what exactly is good sleep hygiene? So good sleep hygienes are actually taking care of your sleep cycle by incorporating healthy habits that can help you to sleep better at night. It could be something like having scheduled time, having regular time for you to go to sleep and wake up. There's also another technique where making sure that we do not take any caffeine or nicotine throughout the day to help improve our sleep after during the night. I understand sleeping may be a bit difficult after we are recovered from the COVID-19, but then it is also very, very important for us to reclaim again our sleep cycle. The second one that we can do is to actually practice healthy lifestyle. So what does healthy lifestyle is? So very simple, eating healthy and well-balanced meal, and also to regularly exercise. These are very, very important for us to take care of our physical health, because physical health actually does associate with mental health. Thirdly, what we can do and try to incorporate is to practice some relaxation techniques. Why I'm sharing with you some relaxation techniques here, because if you realize, based on the physical symptoms that I shared, some of that are actually the physical symptoms that one may experience due to anxiety. So relaxation technique is a proven technique that can help us. It gives us the short-term and long-term relief and relaxation when our stress response is being activated due to our anxiousness. So some of the techniques that you can practice are, for example, like deep breathing exercise, mindful walking, and also art is also something that is proven to help unwind ourselves and trigger that relaxation response within ourselves. Now let's look into the symptoms from the emotional aspect. When we are recovering from COVID-19, I'm sure there's a lot of emotions going through ourselves. We may be overwhelmed with these unpleasant emotions. So I've listed here some of the emotions that one may experience while recovering from COVID-19. So some of us may feel confused, we feel uncertain. When am I going to get better? Why did I get this in the first place? And then we may also develop some anxiety and also depressive symptoms, which is totally understandable because we are being quarantined and we are being isolated from other people. So this is where all the fear, all the worry, all the guilt starts to come in. We feel guilty for our family members, we feel guilty for our colleague, we feel guilty for the society as well. So these are some of the unpleasant, overwhelming emotions that one may go through due to being affected by the COVID-19 pandemic. And aside from that, I also need to highlight this. The research have also shown that those who have actually been impacted or infected by the COVID-19 may develop some kind of traumatizing experience. And this experience, it may be triggering them to be a bit more anxious and also feeling a bit more depressed afterwards. These are just some of the findings that's shown by the researchers, and it is still ongoing findings to actually see how much of this has been greatly impacting those who actually has been impacted by COVID-19 pandemic. So as I was saying, emotional symptoms can be a bit overwhelming for all of us. So I'm going to share with you one technique that one can practice as part of our ways of recovering and taking care of our mental health post-COVID-19 recovery. One of the techniques that I'm going to share with you on how to manage our emotional symptoms is what we call as mindful self-compassion. So what exactly is self-compassion? I want you to imagine, think for a moment, what makes a really great friend? And answers that we usually get when we're talking about having a good friend or great friend is that having that kindness, that support, encouragement, honesty, acceptance, and having someone who is there for you unconditionally. Now, self-compassion works inwardly, doing the same thing as you would do to a very close friend or someone that you love, but now change it to doing it to yourself. So that is what we call as self-compassion. I understand the emotions can be very unpleasant and overwhelming for all of us. So here are some of the techniques that we can use to actually practice more mindful self-compassion. So one of the techniques is what I call as what skill. So what exactly is what skill? So what skill is actually part of the mindfulness technique in which the what skill involves observing, describing, and participating in the emotions that we feel. Perhaps that day you're just feeling so worried. So observe what makes you feel worried and then describe that feeling of worry and also participate. Allow yourself to experience that emotion. It may be unpleasant, but it's okay because emotions are actually good. So secondly is learning on the how skill of mindfulness. You also apply the skill of non-judgmental. Being not judgmental of this feeling that you have. Being mindful of this feeling that you have. And of course, allow yourself to feel the experience and slowly let it go. Now we are going to look into the aspects of our cognition or our thoughts. So when we are recovering from the pandemic or we are actually infected by the pandemic, our thoughts may be diffused with so many unhelpful thinkings that makes us feel bad about ourselves. So I'm going to share with you some of the thinking traps that one may experience in the process of recovery from COVID-19 pandemic. What I've shared here is actually just a few examples. The total number of thinking traps is actually 10, but I'm just sharing with you some of the thinking traps that are prominent for someone who are actually being in this process of recovery. So first is what we call as personalization. So what does personalization mean? To put it in simple words, it means like self-blaming or blaming others. We take things personally when we are being infected by the virus. It could be these questions that we have in our mind. What if I don't recover from this? What if my family members also infected because of me? If only I did not go there. If only I take better care of myself. A lot of what if only, and all of these self-blaming thoughts or perhaps blaming others as well because of us being infected by the virus. So that is personalization. Secondly, on jumping into conclusion thinking trap. So what does this mean? So usually this thinking trap would involve having this mindset of mind reading or fortune telling. Some of us may feel like, oh my God, what are my colleagues going to say about me? I am causing most of my colleagues to go through quarantine and all those kind of things. So we kind of mind read on what other people are thinking about us. Or we may also be doing some kind of fortune telling. If I recover from this pandemic, my colleagues definitely gonna have some kind of thoughts about me. My family members may be greatly impacted because of me being infected by the virus. So again, it's the same thing. There's a lot of what if only. And these intrusive thoughts can be very overwhelming as well. One may experience this, but it is also very important for us to take note of it so that we can manage it better. So I want to share with you this one technique or metaphor that is widely used in the approach of acceptance commitment therapy. This technique is what we call as imagine yourself and be like the sky. So what does this metaphor create is that it provides a platform for any person to explore painful thoughts, and also making contact with painful emotions in a safe way. So how can we actually try to do this activity is first, imagine yourself like the sky. You just observe what's happening on the earth, what's happening underneath you. The clouds may pass by, birds may pass by, the weather may change, it's going to be sunny, it's going to be stormy, it's going to be rainy. So just be like the sky. You just observe what's happening and you are not exactly impacted by all of these thoughts and emotions. You're not impacted by all these changing weathers and all these clouds passing by. So that is how the metaphor works. You observe yourself. Observe yourself with these thoughts and emotions. Allow that to happen, but it does not define who you are. So now we've moved on to the last part of today's webinar, which is on supporting others who are recovering from the COVID-19 pandemic. So what is the best way for us to support someone who are going through the process of recovery? It's very simple. Just ask yourself, how would you want someone to support you if you are in that situation? This is what we call as empathy. So here are some of the tips and steps that you can do to help and support someone. First and foremost is to listen with compassion. Listen to them and allow them to share with you what they're going through. Apply non-judgmental conversation. Secondly, what we can do is to start a conversation to have a better understanding on what they are going through. Maybe we don't fully understand, and making this conversation is very important so we are more aware of these different symptoms that one may experience in the process of recovering from COVID-19. And of course, last but not least, is to determine how you can help someone who are going through this recovery process. I understand we cannot help everyone with everything. So it's very important to ask that person, how can I help you? Perhaps this person needs help with grocery. Perhaps this person needs help with work. It's very important to provide that emotional support and perhaps all the other supports that we can give based on whatever that is within our capacity. So basically, I have shared with all of you here some of the techniques and also the symptoms that we can look out for when it comes to the process of recovery from COVID-19. But of course, these are just some of the symptoms that we can have a check on every day, or we can check on those that we know who are actually in this process. Some of the symptoms, it is easily manageable by doing some self-care and coping strategies. But when it persists for quite some time, and after doing all of these efforts to help yourself to recover, but it still persists, I would highly recommend for you to get the support from professionals when it's too much. It is okay to let people know that you are struggling. What matters is that we are here to take care of each other. Thank you so much for listening. I hope you enjoy and learn a lot from today's webinar.
Your feedback is important to us. So if you'd like to share some notes about today's presentation, please scan the QR code you see on the screen right now.